Starting a family, having a baby, can be a rewarding and exciting experience.
Wow, the baby's really kicking today.
There's a closeness and warmth, love, a lot of good feelings. Unfortunately, however, the good feelings can disappear really fast if your baby isn't healthy or happy as a result of exposure to alcohol, drugs, tobacco, and other substances you took during pregnancy.
My choice of drugs was cocaine, and I used the 8 months of my pregnancy. My baby was born early, a month early. Her digestive system was premature, and she had withdrawals. She had diarrhea for the first 6 months of her life. She stayed in the hospital the first 6 months of her life also.
My wife didn't smoke that much, maybe half a pack a day. When the baby was born, we wondered if it would ever be normal.
I couldn't help but realize that the amount of alcohol, especially that I was drinking, would cause some kind of problems. But I just never considered malformations or mental retardation. I kind of visualized perhaps a small or a scrawny little baby. But I never knew the seriousness of it.
When you're pregnant, a fertilized egg is growing in your uterus. It's floating inside an envelope of fluid, the amniotic sac. The embryo is later called a fetus. The fetus, as it develops into a baby, receives nourishment from its mother through an organ called the placenta. Everything that enters your blood system reaches the baby through the placenta. That includes everything you eat, not to mention chemicals from cigarette smoke and chemicals from beer, wine, and hard liquor. And of course, drugs, from aspirin to those you get on the street. When you get high for two. When you're out of it, so is your baby.
I smoked until the day I delivered. My baby spent weeks in an incubator.
Smoking during pregnancy increases the chances of having a small, underweight baby. And newborns who weigh less than 5.5 pounds often don't have enough fat to maintain a healthy body temperature and are more likely to develop breathing problems and conditions which may cause brain damage.
I want a healthy baby, but I'm already 3 months pregnant, so I figure it's too late to quit smoking, right?
No, actually, that's not true. If you were to stop smoking now, your chances of having a healthy baby will be as good as you never having smoked at all. Do you think you can quit?
For my baby's sake, I'm going to give it a try.
Monique was born to a mother that drank excessively during her pregnancy. She has major medical problems. She's had quite a few surgeries. She's had ear problems. She has mastoid problems. She was removed from her mother at birth by the county because they felt that mother was not capable of taking care of her. She's about 2 years behind in her learning, and she has been in some sort of a program for her learning problems since she was 8 months old.
Fetal alcohol syndrome describes birth defects linked to drinking during pregnancy. These defects include small size, a misshapen face, badly formed or faulty organs, poor coordination, mental retardation, agitation, and problems in learning. Even as few as 1 or 2 drinks per week can damage your unborn baby. When you drink, almost all of the alcohol goes straight to the fetus, but because your baby is a lot smaller than you, your baby gets drunk a lot quicker. And because your growing baby's liver is not yet fully developed, the alcohol is broken down more slowly and stays in the system a lot longer.
It was a great game. You guys, it was a great game. Of course we won. It was fun. You must not have
On my side, it's really hard.
Hey, do you think you should be drinking?
Hey, I don't drink that much. I mean, I get wasted every now and then at a party, but I mean, that's about it. And it's only beer. That won't hurt my baby.
Beer's harmless.
Actually, it's not. Unfortunately, occasional binge drinking with its sudden high levels of alcohol can be as dangerous as regular alcohol use. Beer, hard liquor, a glass of wine, a wine cooler, a mixed drink, all contain roughly the same amount of alcohol, so beer and wine aren't any safer than hard liquor. A father also has a responsibility to help ensure a healthy baby. It's been shown that alcohol can damage a man's sperm, which may result in a low birth weight baby. If you have a friend who drank and had a normal baby, it doesn't mean that if you drink, your baby won't have any problems. Alcohol affects all mothers differently. During the first 3 months of pregnancy, for example, drinking can cause serious damage to the baby's central nervous system and other internal organs. Drinking in the 4th, 5th, or 6th months of pregnancy has been linked with increased chances of miscarriage. Alcohol use in the final 3 months may result in a baby with stunted growth. So even if you don't know for sure you're pregnant or suspect you could be, act as if you were. Once you are pregnant, there's no safe time to drink.
Hello, doctor. Yeah, I'm having trouble sleeping. Is it okay if I take a sleeping pill?
During pregnancy, always check with your doctor before taking any over-the-counter medications like aspirin or aspirin substitutes, allergy medicine, decongestants, cough suppressants, sleeping pills, or even prescription drugs.
I was afraid he was going to die. When he was born, my girlfriend was in the room with me. I could not look at him, afraid of what I might have done to him using my drugs. Until up to at least 4 months, I was afraid every night that he would die on me. And it was real scary. He would make a noise. I was up with him. It didn't matter what type of noise. I was very afraid.
Street drugs. You know what they can do to you, but what can they do to your baby? How can they affect your child later on?
My older daughter seems to have not been affected when she was smaller, but right now she has a hearing loss that they're not sure was caused by the drugs, but I believe it was. And she also has behavioral problems. She's just impossible to get along with. And they said that was due to the effects of the drug on her.
We're foster parents. We've had Wayne since he was a small baby. He was born to a mother that was taking drugs at the time of his birth. The courts took him away from his mother because she is incapable of taking care of him. He's had a lot of problems since his birth with withdrawals, mainly crying a lot, being fussy, having diarrhea, wanting to be held some days, not wanting to be held other days, not sleeping good. Now that he's in school, he's having learning problems in school. He has a hard time staying to a task because he's too busy. He takes medication for his problem. Drug babies have a hard time sometimes being able to control themselves.
Mom, can I go to school with them?
In a minute.
Drugs, uppers and downers, speed, crack, grass, PCP or angel dust, ice, coke. Drugs increase the risk of your losing your baby. Babies exposed to drugs in the womb can have a stroke, causing irreversible brain damage, can have damaged lungs, and small or malformed organs. Drugs can cause miscarriage. They can cause separation of the placenta from the wall of the uterus, which can lead to extensive bleeding, a life-threatening situation for mother and baby. Or drugs can cause stillbirth, that is, a baby born dead. It doesn't matter whether you snort the drug, shoot it, drop it, or smoke it. All street drugs cross the placenta and enter your baby.
For all outside appearances, she looks like a normal 5-year-old, but it's the internal things like you don't notice, very slight things. Her speech isn't up to a 5-year-old level, it's at the upper 3-year-old level. Her behavior definitely is not at a 5-year-old level. I don't know how she's going to function in kindergarten. She still has a lot of bedwetting problems. Sometimes during the day she'll wet her pants up to 5 times. She just can't control. At night, that's from the heroin.
Well, when he was first born, they didn't know if it was heroin or some other drug I was taking. It's called methadone, but they didn't really know which drug I was taking. So, you know, they just let me have the baby, you know. And then after I took the baby home, he was always turning purple and, you know, with chills and shaking and crying. I would rock him and say, don't cry, don't cry, and talk to him. And he just wouldn't listen. You know, he just kept crying and everything until I took him to the doctor one day. And then the doctor told me that what was wrong with him.
Babies born to users of cocaine, PCP, or heroin may be born addicted and suffer drug withdrawal. Drug babies tend to be irritable and startle or cry at the gentlest touch or sound. One study showed that 1 out of 6 babies born to mothers using cocaine throughout pregnancy died of sudden infant death syndrome, sometimes called crib death.
We just want a healthy baby, someone that we could love and take care of.
Your baby's health depends on you, as well as on support from the father. You can exercise, eat nourishing foods, get prenatal care during the course of your pregnancy, and so increase the likelihood of having a healthy, alert baby.
You get a lot of bed rest.
Or you can increase the risk of having a baby with physical, emotional, or learning problems, problems that may last a lifetime. It's your choice. What kind of baby do you want?
Here's Mommy.
Smile. Smile for Daddy.